Good afternoon. Thank you for coming. We have we've been fortunate to make a number of great announcements in the last year, and this is another terrific announcement. It took quite a bit of time to pull together, but we're happy to get it done. As most know, we had a long-standing 20-year agreement with KentuckyOne Jewish Hospital on behalf of our medical services for our student athletes, and that expired last year. We did have an RFP process. Norton was our choice out of that process, and since then we've worked to get a more formal process in order. Things do change along the way, but in terms of taking the next step, we're ready to do that. We've really already done that, to be honest, and I think you'll hear today that we kicked this off really in January, but we got it formalized to a point where now we can come out and announce it. But it's given us a lot of time to integrate the Norton team, along with even our ULP group and other third parties out there, but and then along with our athletic staff, and even inside of that, it's evolved a little bit ourselves. Going back to February of 2018, we made a big announcement in our department around our organizational structure, and we created a position, the Associate Athletic Director of Student Health and Performance. And underneath that position, which now Pat Ivey holds that position for us, we recruited him to the position. We have our strength conditioning, sports medicine, nutrition, and then mental health, which is probably one of the fastest growing aspects of the NCAA as much as at the University of Louisville. So, and kind of throwing that umbrella of services up under Pat, we then join that together with the services that we have with our agreement with Norton Healthcare. So we're excited to get this going, to say, make it more formal, but we're more excited about what's happening with our student athletes. I think that the degree of specialty services that Norton Healthcare brings to us is pretty broad and deep. We've had access to that in our training room. We've certainly relied on them in other aspects, in therapy and so forth, but surgeries. I know our head coaches have already been working with the physicians and staff throughout the spring season, or the remainder of the spring season, and we've had very, very positive feedback, and I think that's most important. And from the student athletes themselves, we know how important it is. As I mentioned, we made it a focus. For me, I just want to make sure their mind and body is taken care of while they're here, and they have a great experience at the University of Louisville. This is one way to secure it. And when I talk to the athletes, I give my own example of someone who thought he was going to play a professional sport, and in between my sophomore and junior year had a shoulder injury that back then, it's a long time ago by the way, back then had a torn labrum, had a surgery in October, was pitching against LSU in March, and it was too quick, and then had another tear, and that was pretty much the end of my career. So I apply those learnings and personal example when I talk to these athletes about making sure they're fully healthy when they get back in competition, and I think we've got a great deal of trust and comfort with Norton and their experts and the team that we get to work with. So while we get to meet with Russ Cox and Mike Goff and Dr. Hester and Scott Watkins and many others, Stephanie Lanham and Sam Ziggy, and all that get to participate in what we do here, we really get to work more day to day with a lot of the caregivers, if you will, and that's who our student athletes get to know, and we get that feedback from them, and I think we're off to a terrific start, and it's only going to get better. I think that's the best thing about it, and I think they've done so thankful for the way they've integrated our ULP physicians and Dr. Becker and his group that will move forward with our caregiving. I know that for us that it provides some continuity of care with the athletes as well. And and I'd be remiss if I didn't say we're thankful for many of the physicians that have been around the program for a very long time. Dr. Raymond Shea, who I went to as a kid with my father, been with the program 30 plus years. Paul McKee, Dr. Paul McKee, and other physicians have done a great job with our athletes, and we're so thankful for them, and we'll have the right time to honor them at a different day. But today we're here to introduce and thank Norton Healthcare for what they've been able to do in short order, and I think what we plan to do over the course of this next agreement with them. And with that, I'd like to introduce their leader, who I've known for a long time, and as I always say, he hired me years ago at Humana, which is true. But today I get to introduce Mr. Russ Cox, CEO of Norton Healthcare.
Thanks. what Vince also had when he had that torn labrum was a really cool stash.
That was easier to fix.
There's pictures to prove it. I also figured out while Vince was talking that he who gets to speak first takes the talking points for the guy who was going to talk next. He had everything that I was going to say, and he said it so well and said it so perfectly. I want to tell you very quickly, 19 years ago, next month, I started working for Norton Healthcare. The day I started, I said Norton Healthcare needs to be the sports health provider for the University of Louisville. So it only took 19 years to get here, Vince, but we are so thrilled to be here. There's a tradition in Cardinal Stadium where when we make it into the end zone, train horn blows, and I feel like after 19 years, as we're leaving here today, we ought to get that train horn blow. We finally got this thing into the end zone. We're so pleased to be in this partnership, and in healthcare these days, it's all about partnerships. There's not an organization left who can do everything by themselves. Norton Healthcare included, University of Louisville included, all the people who've had a part of the rich heritage of the University of Louisville Sports Department are all part of this today. We're very inclusive. We think with having over 1,000 providers, we're going to be able to meet every need any athlete, any student athlete in the University of Louisville may have. We've got some experience with this. We've worked with the Jefferson County Public Schools for quite a few years. We've worked with Bellarmine University for quite a few years. And we really feel that we're prepared to take on the very important responsibility for student athletes at the University of Louisville. We've got the right people, we've got the right talent, and we've got a lot of enthusiasm for what happens in the University of Louisville. Vince used the term body and mind, and I think it's so important to understand that at Norton Healthcare, we're not just about being an organization that fixes something when it's broken or when it's out of service, if you will. We want to be that organization that helps student athletes stay well, to stay engaged, so that their mind can be in the academic classroom doing the things they need to do to prepare for the next phase of life. We want to make sure that we're on a program so that they will be able to perform on that lacrosse field, on that field hockey field, on the football field, on the basketball court, because that's what's important, is keeping them thinking about what's next in their life and keeping them performing at the very highest level they can. So it's very, very much a privilege for us. It's very much an honor for us that we won't take lightly. I do think it's important that I recognize that as CEO, I get to stand up here and take credit for a lot of work that I didn't do. That is part of the job because you get blamed for a lot of it too, as you know. Right. I didn't mean it that way. But Mike Off, our Chief Operating Officer, was always in the middle of this, and you're going to hear from Dr. Steve Esther, who was in the teeth of this as we went. The best part about this is it's a win-win deal. And the people who win the most are those student athletes. So thank you for letting me be here today. Thank you from Norton Healthcare. And finally, after 19 years, we're getting it right. Thank you.
Good afternoon. I'm Steve Hester. I serve as the Systems Chief Medical Officer for Norton Healthcare. And on behalf of our providers, really just want to say thank you. We're really excited for this opportunity, and not often that you can set up a press conference to coincide with a surgical repair and wear a splint at the same time. So, timing on this works. But really, you know, one of the things with our Norton Sports Health program we've focused on for a number of years is how we work with student athletes, not just at the collegiate level, but definitely a lot with high school athletes and with Jefferson County Public Schools. And you know, the real value is that sport teaches our children so many wonderful things. And really the opportunity for us to be there and help these athletes is a big deal. In a number of areas, we're really excited about our participation and ability to do this just through, whether it be orthopedics, sports nutrition, sports psychology, and even the performance side of things. And more than ever, we find that, you know, student athletes continue to be challenged with not just the performance side of things, but all the things that go along with just being a student. And we want to be there to support them. So I think our programs are really adapted well to do that. We're excited about the fact that we've got wonderful providers, nearly 100 orthopedic providers. As Russ commented, over 1,100 providers overall. So we think we've really got the ability to take care of patients in a number of ways. You know, lastly, I want to say that introduce just a couple folks who are key to this for us. Dr. Ryan Krupp serves as our medical director for Norton Sports Health. Sam Ziggy is going to be our director for this relationship. Scotty Newcomer is coming on with this, as Dr. Scotty Newcomer as well, and as well as Dr. Chad Smith, both serving in roles to help with the football component of this early on. And so we're really excited about this partnership and to be a part of such a wonderful athletic program. So with that, I just say go Cards. Thank you.
Thank you, Dr. Hester. I think at this point we'll open up to some questions from the media.
When does this deal expire, and is there a dollar value that you're putting on it?
We didn't really value it in dollars. I mean, we do have, it's more about services. There are some marketing assets that go along with the opportunity, but Norton's been well represented around this campus, our athletic facilities, for a long time in terms of marketing assets. So I think that's where we spend a lot of time, is to, with Dana. I know Dana's the background with help from Norton and Lottie on our side, to just work and try to figure out what is really the best way to go in terms of fulfilling I'll say the stable of products they have in marketing assets or activations. And so it's less about, I say, economics than when you get into really talking about student athlete care.
And the length?
Three-year term, and there's options for 2 additional 3-year extensions.
Vince, when you're talking the structure, how will it differ at all as far as team doctor and who will work with what teams?
Yeah, there'll be some, obviously with some of the doctors I mentioned that won't be going forward with us, right. And the old agreement, there are a number of new doctors that are lined up. I mean, some of them are here today that are working with them, but
I mean, will each team have a specific doctor?
Yeah, so we went through, and Matt Summers on our side has played a role in this, played a big role in this on that front, and obviously they've sat down and made sure we got team assignments. Everyone on the sport front, our sport admins, our head coaches know exactly who's going to be assigned to those teams and where the coverage is. And I think we've already smoothed out process. We're going into the fall, probably worked out any kinks we needed to with some spring sports. We're going into the fall, I think we're in much better shape in terms of coverage and when they need to be in the training room or coming by for checks. I mean, preseason physicals, all those things that we would typically do. Steve, you got anything for me? Nope. Any other questions regarding the agreement or otherwise? Very good. Well, thank you for coming. We appreciate you guys being here and your support.